COVID-19, it's caused a lot of deaths, and also it's caused a lot of people to be very sick. Have you ever wondered how this occurs in the body and how it affects the lungs? We're going to talk about that today. First of all, the virus, as we know, is mainly affecting the lung tissue. And two things that the virus does that I think are worth explaining to you so you'll understand. The virus is taken into the lung. We inhale it in our lungs, and the virus will attack the air sacs in our lungs. At the end of our windpipes, there's a little air sacs. The virus will attack the air sac, and what happens is it will make its way through the air sac and then take over the machinery, or hijack, if you will, the cell. And what happens inside that cell then is the virus multiplies. It replicates and makes multiple COVID-19 viruses. Once the cell gets full of the viruses, it bursts open, and you have multiple COVID-19 viruses in the lung. These viruses go to other air sac cells, go in, make multiple copies, burst open. And so you can see by that how a person can go from one day having very mild symptoms to the next day being short of breath. Their air sacs are being destroyed. The other important cell that the COVID-19 virus attacks are the arteries, the cells that are responsible for oxygen and CO2 exchange in our bodies. And so, same process. It goes to the artery, it goes into the cell of the artery, it produces COVID-19, multiplication, replication. That cell releases more COVID-19 that attacks the arteries and the veins in the lungs. And so now you have a situation where you have significant inflammation going on in the lung, the air sacs being torn down, the artery walls being torn down, and the person goes from very mild breathing, shortness of breath, to being on a ventilator, and in a lot of cases to death, because the lung tissue itself has been torn down by this virus. And so that's why it's very important, and I'm going to continue to emphasize that we wear a mask, that we keep social distancing, and that we also keep our hands washed. Those things right there are our main defense against this virus right now. And of course, you've heard a lot about vitamin D, and so I'm going to come back and tell you a little bit more about how we can fight this virus in part 2.